This is the reality in far too many of our hospitals. Patients, some elderly, some vulnerable, all in need of care, all deserving dignity, left for days in a corridor instead of a ward. It was filmed at a London hospital this week and shared with ITV News. The long line of limbo goes on and on. One elderly man with flu was here for almost 3 days waiting for a bed. We understand 40 patients were left like this at Queen's Hospital in Romford yesterday, without proper access to medical equipment, forced to endure examinations with no privacy. A thoroughfare, no place for the sick nor the staff trying to care for them.
It was like a war zone.
Catherine spent 40 hours on a trolley at the hospital last week. Staff had to perform an ECG in a toilet because there was no clinical space available.
I wheeled the trolley into the loo, and I said, I don't want to use into the loo now. She said, oh no, we're going to do your ECG. I said, in here? She said, yeah, and then she just wheeled the equipment over, put it all on me, done the ECG, put it back and wheeled me back to the corridor. There was no dignity. I was crying all the time.
This was filmed just yesterday. Some trolleys block cupboards where a sign reads, "Please keep clear at all times." The hospital has been rated as requires improvement, but corridor care is not unique to here. Latest figures show in October more than 54,000 people in England waited more than 12 hours in A&E for a hospital bed.
That trolley can sort of just about get through.
The Royal College of Nursing has described corridor care as a national emergency, warning patients are being set up to suffer this winter.
So it's heartbreaking, to be honest. Just the lack of dignity, if nothing else, is awful.
It's dangerous for patients.
It's dangerous for patients. And I would also say it's really distressing for staff. The shocking thing is that this is continuing to happen and increases the risk of harm and ultimately death.
We showed our findings to the Health Secretary. The hospital neighbours his own constituency.
I wouldn't want to be treated in those conditions. I wouldn't want someone I love to be treated in those conditions.
Will you apologise to Catherine, one of your own constituents, who had to wait on a trolley in that hospital for nearly 2 days? She had to have a medical test in a toilet because there was no other space available.
Yeah, I'm really sorry to Catherine and to other patients across the country. Since coming into office, we have gripped the NHS crisis.
You are 2 winters in now and we're still seeing people waiting days on trolleys and corridors. Surely you're failing to fix the NHS.
I was really clear with people ahead of the general election that turning the NHS around will take time. And on so many fronts, we are seeing the plan working. So these are all signs the NHS on the road to recovery.
It doesn't look like it's on the road to recovery when you watch videos like that.
Anyone for a moment who think that just because things are improving, that we are in any way in denial or downplaying how much more there is still to do.
Today, the hospital boss let us in, with the corridor trolleys still in the background.
I don't like seeing it, none of us like seeing it, and it's not what we want the NHS to be about, but we're working our very hardest to try to make sure that we do everything we can.
Queen's Hospital has apologised to these patients, saying it's not right and isn't fair. The hospital, like many, says it needs funding to improve facilities and eradicate corridor care.
And Rebecca is here. I mean, this is shocking to see, but the truth is that this is not just a problem isolated to one hospital, is it?
No, and to put this into a bit of context, really, just take a look at this graph which shows the picture right across England. 10 years ago, in October 2015, just 58 people waited more than 12 hours in A&E for a hospital bed. Now, the figure stands at more than 54,000 people a month. A huge increase. Now, not all of those people will be waiting in corridors, but some of them will. The government had promised to publish data specifically on corridor care, but 6 months on, we're still waiting for that data. Experts say if we really want to tackle this problem, we need that transparency. We need the facts. Just some anecdotal evidence, though. Today, we have been contacted by hundreds of people sharing their own experiences. Some of them have even sent in their photos. They talk of the indignity of being treated next to dustbins, of nurses inserting cannulas in corridors, and of elderly patients left sitting for hours on end in hard chairs. There is no doubt that all of these images are really shocking, but I think one of the most shocking things is actually this is not that unusual anymore. The danger is that this is actually being normalised in the NHS. The problem is that in hospitals there are often backlogs caused by delays discharging patients because of a lack of social care in the community. And experts say until we tackle that huge problem, this sort of misery in A&Es is just going to continue. But remember, we're only at the very start of the really busy winter period, and the months ahead are going to be really tough, not helped, of course, by the planned doctors' strike just before Christmas.